I like to explain what's called frame-based feedback, which we developed in conjunction with my colleagues at the Center for Medical Simulation, because I think we can't just tell people to do feedback better or more frequently. Given all of the emotions we talked about, the barriers, if you will, the challenges of giving feedback, I think we need to actually help people do this. And so this is an algorithm. Frame-based feedback is an algorithm which is simple in terms of its structure. And it's basically a three-step process, which is me, my frame, you, the feedback receiver's frame, and us trying to reconcile those two frames. And by frames, we mean their point of view. What is my point of view about what happened? What did happen? And then what is the feedback receiver's point of view? So I'll just describe the three steps in a little bit more detail. The me part of it is to be very specific about what the behaviors were. It's no use if I come to you and say, you're arrogant, you're intimidating, because how do you then translate that into a change that you can make? It has to be behavior based. So I might, first of all, start off by giving the context, like asking if it's okay to meet with you about something that happened, and then also saying, look, this isn't a performance evaluation. There's plenty of wonderful things about you, but I wanted to speak to you about some specific concerns that I have. So it gets people, I think, feedback receivers' denial a bit down, because then they understand I'm not criticizing everything about you. Maybe they hold on to their sense of integrity. So setting the context and then being very specific about what the behaviors are. So when you roll your eyes at the when a medical student is making a point, or one of the residents is making a point, or you sigh, those behaviors actually demoralize the trainees, the learners. And the reason I'm concerned about that is, I'm sure that you care about people's learning, and this actually really impedes learning when people have a sense of that they're not respected, that they can't ask questions or speak up. And so I wanted to bring these to your attention because I think they're getting in the way of what you want to have happen, which is people to learn from you because you have a lot to teach. So that's the first step, the me as the feedback receiver, my frame. The second step is the you frame. So for me to tell you, this is what you're doing wrong, this is why I think you're doing it wrong, and then leave the conversation, that really is not going to get to your being able to understand how you might be motivated to change your behavior and what you could do to change your behavior. So I know as a feedback giver what happened, but I don't know why. So I need to maintain that curious stance that I mentioned for me to be able to ask you, so tell me about what your perspective is. Are you aware of some of the behaviors that I mentioned? And how do you see this feedback that I'm giving you? With a sense of, not being sarcastic, like, what are you thinking? But, tell me more about what you're thinking. And then that gives you a chance to reflect on the behaviors. Maybe you're not aware of them, or maybe you do them because you think that's the right thing to do. And then the third step of the algorithm is the us. Okay, how do we reconcile either our differences in our frames, and also what's the overlap? We can both agree, you're very interested as I am in learning and having people around us learn. So what is it that we could take from this conversation? And I think that having common ground, reiterating the fact that we both care, is really important. If it's relevant, it may not be, but if it's relevant. I think the challenging thing about the us component, and really about feedback in general, is it's very context dependent. So if I'm a program director and you are a faculty and you recurrently have demeaning behaviors towards the residents, at the end of the conversation, I need to put some boundaries on that. So even if you don't agree, I might have to end the conversation with something like, look, I see that you think what you're doing is okay, but I'm here to tell you it's not. And it's really kind of goes against, it undermines the clinical learning environment. I need you to think about changing that behavior. So that's very different from if I'm a colleague and I have no, if you will, supervisory type of role over the people that you're either harming or of you. I might just say, hey, or maybe it's an interaction you and I had that I've given you feedback about. And I might say, look, I hear that you don't you don't see it from my point of view, and that's okay. But I'm your colleague. I care about our working relationship, and I just thought you'd want to know. So thanks for listening. So the us really is very dependent on what the context is, both of our relationship and also the actual things, behaviors about which we're giving feedback.